So hello, I'm Dr. Kelly Martin Chu from Pink Tent, author, speaker, and women's empowerment coach. And today I have Dr. Sheila here, and I want to welcome you.
Thank you so much for having me.
Yes, so excited. So let me first give you the official introduction. And so she is the author of a book, Yes, I Have Herpes. But let's learn a little bit more about her before we get into conversation. So Dr. Sheila Loanzon, also known as the Compassionate Gynecologist, is a board-certified obstetrician and gynecologist with over 15 years of patient and personal experience with the diagnosis of herpes. Dr. Loanzon offers women-specific tools to shift their perspective, gain insight, and move forward confidently and in self-love. Dr. Loanzon received her BA in biochemistry at Vassar College and completed medical school at the College of Osteopathic Medicine of the Pacific. She currently works at a large multi-specialty practice in California, and you can find her at Dr. Sheila Gyne. So welcome!
Hi, thank you.
Hello. So let's just start off with a little bit of your story. Maybe we can go all the way back to, the beginning.
Oh gosh, that was a long time ago. So I was diagnosed when I was 20 years old. I was in my first adult relationship, and I was a sophomore in college, and it was with, I was of the belief, wait until you get married, until you're in love with someone, and, Catholic upbringing, Filipino. So it just kind of came with the territory. And I found a guy that was just wonderful to me. And so we started kind of exploring our sexual career. And then I just one day was like, oh my gosh, it hurts to urinate. What is going on down there? And I was clear across the country. I'm a Californian, but I was in New York at the time, and went to the campus clinic nurse, and she was just like, yep, looks like herpes. I did a culture. I know that hurt, and we'll see you in a few days, and here's some medication. You should start to feel better. Okay. At that time when I was in college, they didn't have the internet. They didn't, it wasn't something that you talked about readily. There wasn't someone that you could look up to talk to about it. And I just kind of festered in that I think this is bad, but I'm not really sure. I don't think I'm supposed to bring it up at the cafeteria, so I'm just going to keep it quiet.
Not cafeteria conversation, right?
Yeah, exactly. And so I did, and I had told my partner, and he never knew. He had cold sores, so he had oral HSV1, and didn't know that you can actually transmit that genitally. So it was something that I really kept to myself. We were together for about 2.5 years, so quite a long relationship. Things didn't work out, as many college relationships don't. And so when I just kind of moved on, I didn't really kind of process, and I never really got a talk of safe sex practices. What does this mean? How do you talk to someone about it? This is how you could feel in a social situation, or in an emotional, personal situation. And so I just was kind of just dating and not really focusing. And at the same time, I did have a medical background. I was pre-med at the time. And so when I got to medical school, it really just kind of hit me like, oh gosh, I am not really practicing life the way that I should be. At the time, I had ended up meeting my husband that I married, and we had known each other for quite a long time before we became sexually intimate. And the next day, he actually approached me and said, I made a mistake. I actually have genital herpes, and I didn't tell you. And this was a man that I thought I was going to be marrying. So I was just like, okay, this is my kind of crossroads. What do I do here? Do I admit that I have it? Do I admit that I don't? Where do I just kind of go along with it? And I chose the latter. I wanted to, for various reasons, and you can certainly pick that up in my book, but there's just a lot of different reasons why I felt that was the safer choice for me. That marriage.
Real fast, do you think that it was because of that fear of rejection that we all experience of why you kind of kept it inside and didn't disclose?
I actually think it was the opposite. It was that I
Okay.
didn't want to lose him. I wanted to feel vulnerable and to have that kind of like Papa Bear take over me. Like, oh, I gave this to you. I'm going to now protect you from anything from happening in the future.
Okay.
So, which was my own, where I was emotionally at that time.
Right.
And that just kind of really speaks to where I was at. And the marriage did not work out. And I subsequently went through, and at this point now I'm about 27 in my 30s, and I'm just kind of realizing, okay, now I know the medicine. Now I am board certified.
Yeah.
And now this really is just so incongruent with who I was, because in my daily life, I was so honest. I was so healthy. I was just, explaining so many things to patients. And here I am not quite living that life that I'm preaching. And so I actually ended up seeking the help of a executive coach. And we really, over a 1.5-year process, went through a lot of different things. And, about 3 months in, he's like, I feel like there's this block. There's something. And I'm like, do you think it's because I haven't told people that I have herpes? And he's just like, oh my gosh. So that probably took about 1 year of processing, because of course it kind of weaves in with other aspects of your life. And then you have to, work through those parts. And I came to the realization that I have a unique story. I have a unique story being a physician, being a patient, and I didn't think I was alone. And I just wanted to be that person that people could look up to and say, this is a professional. This is also someone who has processed through their emotions and where they're at. And so the decision to write the book was essentially just to say, this is my story. People can like it or not like it. I'm living my life a specific way now. And I really just want to give some guidance to people who are really struggling.
Oh, that's beautiful. That's
Yeah.
beautiful.
Thank you.
So like myself, it's some of our story is similar in the sense of you contracted in the same way I did. And I think that actually brings up one of our myths, which is so many people think that herpes is related to people who are very promiscuous.
Mm-hmm.
And both your story and my story was that it wasn't through intercourse, and it was
Mm-hmm.
through an oral cold sore
Okay.
that we both contracted the virus. So I find that interesting. It's almost like we're both here to teach that piece, right?
Because I think, and what's interesting too, is being a physician, when I told my friends that I was writing this book, even my physician friends were like, I get cold sores. Does that mean I could have given it to my husband? And I was like, yep, probably. And you guys have never had an outbreak. And, these are board certified people. And so there's just a lot of stigma, changes in knowledge that's out there. And it can be very difficult to kind of fight that fight, to educate people.
Absolutely. Absolutely.
Mm-hmm.
And it is amazing. We make the assumption that professionals would know the ins and out of every little specific thing. And as a doctor, we take on so much information, and, we get the highlights, but, getting down to some of the specifics, and then the emotional impact. I'm sure as a doctor, having your book and being able to share that, most doctors, they don't have the time, right? Mm-hmm. And even if they're compassionate and really want to share those nuggets of information of what it's going to be like, and to prep a person who's just being diagnosed. I mean, there's just not enough time. There's not enough time.
And I have to admit, in the beginning, even when I had come out and said, okay, I'm going to write this book, and I told a lot of people, I really didn't actually tell patients in the office when they were diagnosed, because really it's their experience, it's their shocking change of life. And so I didn't feel that it was appropriate. And even now, it's still like, it's important for them to have their process.
Absolutely.
And being a physician, giving that diagnosis, I usually have to say, okay, we might have to talk about this in the future. I cannot possibly give you all the information. I know you're going to go to Google anyways. So let's just try to, kind of firm down some solidified facts first.
Yeah. So as a doctor, if you had a little bit more time, let's say you've just diagnosed someone and maybe you don't have another patient in your schedule you've got a little bit of extra time. What are some of the things that you would recommend or that you would tell someone who's just been diagnosed that you think that would be really beneficial? Some highlights.
First, I would say breathe, because
Yeah.
most of them are not. So I think that just gives us a moment. I think it's really important to realize that everybody survives. This is not going to be something that kills you. It is going to be something that you have to be a little bit more cautious about and aware about. But life certainly does not have to stop.
Right.
It would be wonderful to tease out a little bit their kind of either relationship status or where they're at, just because I think the next question that comes is either where did I get it from or how do I explain this?
Yeah.
And, if they're with somebody, was it this person? Was it that person? Who gave it to me? When did it happen? There's a lot of questions about when.
Yes.
And has this been happening for a long time? And then having the conversation of how to tell them. I think that's one of the biggest things. And, in my research, I didn't quite find out there kind of like a script of this is how you can say it. And even in the beginning, I realized when I was trying to go through it myself, even though I think I'm fairly eloquent, I'm just like, how am I going to get these words?
Yeah.
They kind of verbally vomited and they were kind of chopped up. The sentences were all off. And, so I think even just being able to talk through with someone so that's authentic to them, because if not, it's just going to feel like they're a person in a play, and it's a script that they won't recognize or identify with.
Right.
Certainly safe sex practices is important because that was something I didn't really get. Let's see. I think that those are kind of the basic highlights that I would touch upon at that point.
Yeah, absolutely. Do you want to highlight some of the myths that you're out there to really break through and to really share the truth? I know this is a lot that we talk about in our community, but it's so nice to have somebody else, for me to allow to lead here. So what are some of the common myths that you've come across that you really want to make sure that we break those myths?
The other day I had someone whose brother was recently diagnosed, and so she lives with him and was very curious, can I, after the cup is washed, can I use the same cup? Do I need to wash the towels, as soon as he washes his hands?
Yeah.
And those are, can I get it from the toilet seat? If we share from the toilet seat, and all of those are no.
Yes.
Because in the end, herpes itself is a skin situation where the outbreak has to be skin to skin transmission. And so it really can't go through inanimate objects. Now I always caution people in terms of using the same lipstick or lip gloss or chapstick from other people, because the likelihood of a transmission is low. At the same time too, why kind of take on that risk if you can avoid it? And I think everybody should have their own chapstick anyways.
I agree.
So, I guess the other myth out there is that it's promiscuous people, which you've already mentioned, and that is not necessarily the case. You can get it from just one person, one sexual encounter, and that can just be the sole transmitter. I think the difficulty that we have in our community is in terms of medical information, we are shunned away from doing blood testing for the diagnosis of herpes. Really, it's a genital culture or a culture that comes back positive. And so now I'm seeing that there are a lot of people who are getting the testing, and that is really freaking people out, because it's like, now I feel like I'm a ticking time bomb because I've never had an outbreak. Now I'm positive by blood. When is this going to get me? That kind of idea. But I will say in our CDC recommendations, our colleges who are, certifying us, the recommendation is to really only diagnose based on the culture because of the emotional stigma that comes upon it. There's certain situations where you can order the blood testing, but those are few and far between, just again, because of the false positives and the emotional stigma that does come with it.
So that is the doctor hat and what the guidelines that you're required to abide by. And then there's the personal life, the you having impacted by this virus and potential partners. What is, if I can ask, I don't know if you can kind of off the record, what is your opinion on this? I mean, I can tell you, within the community, there can be a lot of anger of, look, I asked for an STD test and herpes wasn't included. And they find out later, that they have it, or there's a partner, maybe they're getting ready to be in a partnership and they've had the talk and they've decided that the partner should get tested to know where their baseline is, but they're asymptomatic. So I'd like to know if you're able to speak, taking the doctor hat off, because I know what the guidelines are. What are your opinions of the herpes not being included in a standard STD test and the recommendation not to test someone who's asymptomatic?
I will have to say that in my exposure now to all of these communities and discussions, and I'm seeing how much it impacts people and the confusion that comes with the testing, and then the doctor, saying their specific script. I am a fan of getting the testing to help you sleep at night. The difficulty is that what will help you sleep at night, what will give reassurance. And that is where I think the situation lies. If people are very concerned about herpes testing, I would be very explicit and ask for it. And the physician may or may not order it based off of the clinical situation, because in the end, really is this test going to change management? That's what we end up thinking in our head. I will say that I have more leniently ordered it now that, well, maybe because people have read my book, but just because I think, that discussion is out there. But at the same time too, you just have to understand that the physician may not know how to explain it. The recommendation is to not. And every situation is very unique. But if that's something that they're interested in, be very specific to order it, because in most situations, it's going to be not included.
Okay.
Yeah.
So let's talk a little bit about, you have the steps women should take. So what are some of the steps that you think women should take, and really from that empowered place?
So what I've discovered is that a lot of women, just because that's generally who I end up speaking with, a lot of women end up focusing on other people. Just, I think, in just basic life, whether it's a maternal instinct, whether it's just us wanting to take care of other people. But I discovered that when I started to switch the focus from other people to myself, particularly in a job such as medicine, is when I really was actually able to give back to other people. And so I think self-care is so important, just to be able to recharge your battery. It's kind of like being in an airplane that's going down and they're just like, put on your mask and then help somebody else. It's that same thing. How can I possibly help somebody else when I don't have the oxygen? And so whether that's something as simple as a walk by yourself, talking to a girlfriend, some people do feel recharged by talking to other people. I myself just like to sit on the couch, meditate, just do things that are really focused on myself. Yoga is really wonderful. So I encourage women, because I am seeing those women in their 50s and 60s who have donated their lives to everybody else. And then they kind of look around and say, what about me? Yeah. And so then they end up coming to me asking for antidepressants. I would rather have them just work on the other aspects of life that I think will enlighten them so much more in the long run.
Yeah, absolutely.
Yeah. And I do encourage people to talk to others. I think that is also something very important, because support is so very helpful. In my process of healing, whether it was talking to my executive coach, whether it was going to a support group, whether it was talking to my friends once I was out, all of those people give support, and it just helps you realize, wow, number one, I'm not alone. Number two, people are not as mean as I think that they are. And number three, people are willing to be there and support you and hug you and let you know that everything is okay. And I have to say, once I actually came out on Facebook and told everybody this book was coming out, several people approached me and said, I have the same thing. Some people said, that is really awesome. I'm so glad you're doing this. This book is needed in the community. And so it just really kind of just touches base. And if it's just one person, you know?
Yeah. Yeah. What about pregnancy and
Yeah.
herpes? What can you share with our audience? Women who want to get pregnant, they're fearful of fertility and having babies and transmitting the virus and all of that fear associated. Can you speak a little bit about that?
I love it. Everybody go procreate if you would like. It is A-okay. Do it. Keep me in a job. No, it's really, I think the great thing about herpes is it's manageable. It's treatable. There are medications, and I have delivered numerous babies out there to mothers who are herpes positive, who have or have not told their partners, and they're totally okay. Those babies are wonderful, and they're healthy, and they don't have the virus. So I think there's a few things. I would encourage women to, when they come in for their prenatal appointment, to let their physician know, whether it's oral outbreaks or genital outbreaks, just so it's on our radar in terms of how to manage them during the pregnancy.
Okay.
In the end, we actually just use a suppression medication at 36 weeks. So, and then if there's an outbreak through the pregnancy, then we would treat it at that time. Sometimes with pregnancy, the immune system can be a little low. And so outbreaks can be more frequent, but there are treatments. And it's just oral pills that you would end up taking. The reason that you start the antiviral at 36 weeks is so that you prevent any outbreaks for a vaginal delivery. And in my experience, those babies have been born vaginally as long as they didn't have any other obstetric reasons to be delivered by C-section. And shortly after delivery, you stop the medication.
Okay. I'm curious, is if you had a woman who was ready in delivery, and let's say that she had a mild outbreak and the site of it was like on her hip, and there was no visual signs on the cervix, and there was nothing vaginally that you could see. I'm just curious in those kinds of situations, because I've been curious, and everything else is normal and progressing normally. What knowing that's the only information that I would have, what do you think you might do with a patient like that?
Yeah, so I would actually, if the outbreak was on her hip, and there was no, she wasn't touching her hip and then touching anywhere else.
Right.
I think it would be absolutely fine to have a vaginal delivery.
Okay.
Because in the end, really you're looking for the contact of where the baby is going to be exposed. And the baby is not going to end up on the hip.
Exactly.
So it should be just during my training, they actually even used to say if a woman had an outbreak on the rectal area, if you just covered it with a specific plastic thing, she could actually deliver vaginally. Yeah. Now, I will say every provider is different.
I know
every culture geographically is different. And every physician's knowledge can be different. So some may feel more comfortable to do it by C-section just to decrease the risk completely. Most of us, as long as you keep that area covered and aren't touching it and the baby's not going to be anywhere near that during the delivery, would be fine to deliver vaginally. So I can't say specifically everybody blanket.
Absolutely. But I asked you that question more than anything is I want to empower women that they're so fearful, and they think that the opportunity of having a vaginal delivery, they think that that's no longer available. So to even hear that from a OBGYN, I think is really important. And as I said, I know that was a very specific question, and each case is unique, but even to hear that there is a possibility, like even if you had an outbreak that could be covered that wasn't, as you said, as we know, it's skin to skin contact, and women need to hear that. It's not through the blood, it's through the passage of the baby through the vaginal canal. And it's just so nice to have a board certified OBGYN out there delivering babies, to hear that even then there still is a possibility.
I will say, in my whole 15-year career that I've been in OBGYN, and I've delivered some like 3,000 babies at this point.
Wow!
There's a lot of babies out there. Oh, it's wonderful. It's actually, it's really fantastic to be the first hands to hold the baby.
Yes.
Hand them over. Of the 3,000, I would say maybe 500 or so, maybe probably less, test positive for herpes. I've only had to do a C-section once because there was a lesion of herpes on the cervix. That's the only time in my whole 15-year career that I've ever had to do it. And even, as long as people are taking the suppression medication, which keeps the virus away, the outbreaks away, there's really no restriction. Usually it's, people have C-sections for the obstetric reasons, but
right.
Not
exactly.
Mm-hmm.
Exactly. Okay. Wonderful. Good to hear. Good to hear. Because I know there's so much fear. I have read a little bit of conflicting data. Does the herpes virus impact fertility at all for women?
There was some literature, I feel like a year ago or so, that came out. It has not quite disseminated out through my college, and that's really where I end up getting my, evidence-based information.
Yeah.
And the difficulty is that there can be so many different factors that can affect fertility. How can we say for certain that it is specifically that? So at that point, I can't necessarily speak to and say that for certain.
Okay.
Yeah.
Let's talk a little bit about, if you're willing to, your personal journey of disclosure. I know that there was a time where that you weren't disclosing, and there's obviously been some beautiful healing on your part, and kind of where you are now with that, and the journey that you've taken, as far as, because I've read your book, and I know there have been times that there was even rejection. Like, how did you deal with that? How have you dealt with that?
Yeah, so I think the great thing about working with my executive coach is that we actually took dating off the table. We took dating off the table because he's like, there's no need for us to add in somebody else's emotions. Let's just focus on what's going on within you. Yeah. And that's where a lot of that healing, just from family things and cultural things, social expectations and judgments that come through, that I really ended up processing. And about 6 months said, okay, I think that we're ready. And I was like, oh, I don't know if I'm ready. And it was a slow journey. The great thing is that when you end up working on yourself, you end up attracting a totally different character.
Yes, you do.
And it's so hard to put into words, but it's literally like day and night, like the type of person. And so it was, in the end, a focus on myself to take the power away of the virus and back into my hands.
Yeah.
And I did meet these gentlemen through online dating sites. So they were the popular ones that are out there. And really, my coach, Julian, said, let's just sample the water and see what's out there, because things are still changing. You're not quite sure what you want. I kind of feel like medical school kind of pushes back the growth in terms of dating. So I feel like I was kind of like 10 years behind the 8 ball, which is fine.
This is fun. Because as you said in your book, there's no time. I mean,
there's no time.
You go into medical school and it's full on. It's full on. I was always shocked that, I mean, there are men and women getting married and having babies, and I'm like, I'm just trying to hold it together.
Yes.
Right?
I'm just trying to take a shower, really.
Yes. I was like, men, I don't have time for them. I'm gonna do my work. So I can relate to that.
Yeah. So I feel like I was delayed a little bit.
Yeah. I felt delayed too. So anyway.
Yeah. And so it was really just getting to know people and what they were about, and if that was something that I could see moving forward. And I remember that there was one instance and the relationship was moving in a specific way. And I was just like, oh my gosh, I have no idea how to tell him. So I told him over the phone. I kind of had a script. I stuttered. I was sweating. Down my back, and you just blurted out, and he said, okay. And there were some other relationship things that I brought up, and he's just like, well, I think we're in different spaces right now.
Yeah.
It's not about the herpes. It's not that. It's just, he was looking to settle down right away, whereas I was just trying to figure out what I wanted. And so it wasn't a connection. And I found more and more that I was having the conversation, the more and more it was just like, hey, this is who I am, take it or leave it. If not, there's another guy that's coming. And once I felt like I got my groove back, to say, then I was just like, okay, then the world is kind of open, and we'll just see what happens. Because in the end, I do believe that there's a plan, and I do believe that there are good people out there. And once I was kind of nearing the relationship that I'm in now, and I have been for a year and a half, then it was a little bit more, the guys were like, what? I don't care. That doesn't matter. They were educated, they were kind, they were eloquent. And it was just a whole different universe, really. And so the person that I'm with now, he's just like, I had a partner who also had herpes, and we just were careful. And he's Canadian, so maybe he's just a kind guy. I don't know. But he's fantastic. And we've been doing very well together. And I, have had some outbreaks, and we've just avoided and been very careful. And it's a fact of life, and it doesn't stop us in any way. And really, intimacy doesn't end up necessarily being intercourse. It doesn't have to be sexual. And a relationship can actually really grow. And that's what I found is that you really get to the core of the person, the way that they end up treating you.
Yeah. Yeah. So yeah, the quality of the man that you're attracting, definitely I think is impacted with where you are. I mean, when you get into that place that you said, like, you got your groove on, like Dr. Sheila's got a groove on, like there's that level of confidence. It's like, look, this is something I live with. And, if you're not okay with that, then I'm okay with that. To know that it doesn't define us. Right. And I, like you, do believe that there's a greater plan. And that plan, it's like, that you'll be, for the person who's right for you, then this is not a deal breaker. It really isn't. It really isn't.
And when I started with my my coaching, my goal was essentially like, hey, I want to be 45 years old, maybe not have kids, but I want to be an awesome doctor, and I want to be a wonderful aunt. And if, my job is to be a physician and then travel the world by myself, then I want to do that. I want to gain that confidence to not have to rely on somebody else. Sure, being in a relationship is great. Sharing experiences with someone is wonderful. But if you have yourself and you're strong in that, who cares about anybody else?
Exactly.
You can just smile and go about your day. And I actually have people are jealous of that. They want that freedom and that ability to confidently stand on their own. So I was just like, maybe this is my path. Maybe it's not. I just want to get to a comfortable place where I can look at people and just say, this is me.
Yeah. Yeah. What I love about you and reading your book, revisiting that Hippocratic Oath, right? And you have that in your book, and I just love it. I really get your passion for helping people, and how that has really informed you in your journey. And what I'm really hearing you say in the beginning of your coaching, and this is often what I recommend to the women that I work with as a coach, is I say, you know what? Let's work on you first. Let's work on that self-care. Let's work on how to manage the symptoms, how to have the talk, like all of that, because we get to rebuild you. And let's put the focus on, also things that you love. So for you love your work. And so being able to, to participate in something where you're making a difference. I tell people when they're depressed, one of the reasons they're depressed is that they're thinking depressive thoughts.
Mm-hmm.
right? And so, even just for a moment to think, okay, how could I impact somebody's life right now? And
Mm-hmm.
to go out and to write a thank you note, or to go have lunch with a friend, or all of a sudden the focus goes outside of ourselves, and we're able to give back. We actually feel better about ourselves. So like shifting that focus. So I think there's like that duality of focusing on ourselves for the self-care, but when we start to get depressed or hard on ourselves, or worried that no one's going to love us, take a moment to give back, and that our whole world can light up when we can give back.
I think gratitude is largely important, and I think having a positive outlook really helps. And not, I would say, if someone was to look at both you and I, they'd be like, oh, they're just genuinely happy people. And I know that there are people out there who may not have as much light as much as perhaps the more kind of dark side. And I don't think that that is a bad thing. I think that's something that makes us all unique and wonderful, and makes it so we're not all bland walking around, interacting in the same way.
Right. Right.
And I think embracing where you're at, and that it's a journey, and that it's just one point in time, and in a year might be totally different. I mean, if I was to think where I was 2 years ago and now, I mean, it's eons from where I thought I was going to be. And so it's a process. It's not a static choice. There are choices to progress one way or another.
Yeah. I tell women, I said, the self-acceptance and peace doesn't mean that you need to be me. Mm-hmm. What it means is that, it's just finding what's going to work for you. And for some people, what that means is it's between them and their intimate partner. That's it.
Yeah.
And for other people like you and I, it progressed. I did not start here, as you did not start here, right? Progressed in a place where there was so much passion in our hearts to share, so that we could stand in our power and speak for those who cannot speak in front of, a large audience. And that's not the goal. That's not the goal to become, Dr. Kelly or Dr. Sheila. The goal here is for you to find peace and love within yourself, and self-acceptance. And we're all different, and that looks different for everybody.
Yeah. It's so funny that you say that, because I'm thinking back to, I think probably the first interview that I gave, and I think I was tearful through the whole thing. And then here, and then just kind of being like, yep, this is it. Even in that year, there was a growth that happened. So there's a process, and I encourage everybody to be there. And I know that there are certain groups out there on the internet that help give support. And I think that those are really wonderful places for people to start. The difficulty is that it's on this level that some people may not be able to get out of. So I think it's a worthwhile place to be in, but then there's a next step, and there's a next step, and there's a growth that can occur.
Yeah. As far as dating, do you think there are some people that are considering dating within the community, within the herpes community, and there's some people that don't even want to go there, and they want to date whoever they want to date? What are some of your opinions on that? Because there are so many resources, and just wondering what you think about that.
Yeah. What I'm in favor of is love. However love comes. I really think, I think that wherever someone feels comfortable is where they should be. If we were to remove any of the judgments that I think some critics may have of one group versus another, in the end, it's, what do you want? If you close your eyes and you thought, who am I looking for? Am I looking for someone who has herpes or does not? Then I would start there. I really think that there's pluses and minuses to both groups. And that's for the individual person to decide. But I'm for whatever helps people find a space that they want to be in.
Yeah. Yeah. You have a similar opinion to me. It's like, just go out, whatever feels right. And sometimes you might start within the herpes community, and that feels safe. And then you realize, wow, I want to branch out. And other people dating within the community, it's like, they don't even, that doesn't feel comfortable. So I'm in total agreement with you, is start where you are.
Yeah.
And just take baby steps, just
Yeah.
baby steps.
Yeah, exactly. Because I mean, if you're finding who you want your final partner to be like, whether you are looking for your final partner, it's going to come forward regardless. Because in the end, right, you're not trying to force a relationship. You're not trying to fill a box. And it comes down to the person, because I suspect people end up using herpes only dating groups because they're trying to find someone who's open-minded. I will tell you, there are plenty of open-minded people on the other side who are probably more accepting and more open than some of the other people. So it's really just finding what works the best for you.
Yeah. Yeah. I'm trying to think if there's anything else. Is there anything else on your mind that you want to share with the audience?
Yeah, I just think it's really important to know that there are people out there who want to help. And there are people out there in a variety of different ways, whether it's you or I, whether it's people through online services, through phone calls. There's support, and people don't have to feel alone. I know it really feels like it, but there's people who are out here surviving. I've made some mistakes. I've learned from them. I haven't, I have had a fair share of trolls, but people aren't going out there and writing articles about their herpes lives either, most of the time. So, and I'm still surviving, and people can.
I would say you're thriving, not
surviving. Yes. I am. And it's a wonderful way to be. And if we could all just have a little bit of encouragement, I think that stigma will actually change.
Yeah.
And it takes a lot of work, but if we just go person by person, I think we can get there.
Yeah. Have you ever thought about the stigma in terms of how stigma has changed over the years with HIV and HIV, the positive community, versus herpes? It seems like herpes is, obviously HIV is something you can die from, so it's a much more serious condition.
Mm-hmm.
But what I have noticed is, seems like herpes education is kind of behind the 8 ball as far as stigma. Not that there's not a stigma associated with HIV, but I'm wondering, what are your thoughts on it? Like, how do you think as a community, how can we break the stigma?
I know. And breast cancer is actually one of the stigma. Yeah, that was a big push, I think, in the 1980s to really normalize that conversation. And the difficulty, I think, is because HIV is something that you can die from, and there's a lot of research dedicated to it. And there were fairly prominent people in the community who came out and stated their health status. And so I think that really kind of changed people's minds. And it was showing up in TV shows. It was showing up in different places. So I suspect this kind of STD might do the same thing too, where we need some kind of larger support. I'd like to believe that you and I can make a big movement and make things happen, but I don't know, in our day and age, a celebrity.
I know. Well, you do. You see these, and you spoke about that in your book, and I loved it. It's like, yeah, there are, I mean, for those ladies that are listening that don't know, ladies and men, it's like there are celebrities with herpes, believe it or not, you know?
They exist and no one claims it. And I just maybe, reach out to them and see if we can get them to change their minds. But in the end, I think if you're living as a whole person in 100% way, it doesn't end up necessarily mattering, what the stigma does around us. So I was just keep turning inward.
Yeah. Turning inward. And I think education is huge.
Yeah.
I think
it's very common for people to come in with their partners and kind of explain what's going on. And most of the times then people end up processing at home and then send me an email and say, hey, we thought about a few more questions. And so it's an ongoing process, and education, and importantly, where you get that education from is very important. So I encourage scientifically backed resources.
Absolutely. Well, I've had so much fun with you today.
This is fantastic. Thank you so much for having me.
Absolutely. And if you want to, because I don't know off the top of my head your website or how people can get your book, the Yes, I Have Herpes book.
Yes, so it's actually available on Amazon, and it's in Kindle form. So if you're afraid of the title, I know it's a little bit bold, you can always download it on your Kindle or order it as a hard copy. And then I do have my website. I did actually adjust it from the website that was mentioned before. So it's actually just www.dr and then Sheila, Sheila, Loanzon, Loanzon at hotmail.com. And you can certainly Google and you'll see all the articles and the book and the website and everything about me. And I really encourage people to go ahead and check it out.
Awesome. Wonderful. And for those listening, I really encourage you to engage with this video. So I'm sure, I don't know, I'll send it off to my assistant and she'll make it be, make it so. But any engagement, would be wonderful. You can email us and ask us questions. And we really, both of us, I think you can tell by now, we're both passionate about really making a difference in your life. And raising your hand and asking questions is a great way. So I'm sure underneath the video there should be a feed and just great resources. The community that I have created is pinktent.com. There's a forum on there, not a form. So that's also a place to get support and ask questions. And Dr. Sheila's book is amazing. I just read it, and I'm just so thrilled that we were able to take this time today. And sincerely, thank you.
Thank you very much.